Hi, my name is Joni, and today I want to show you a self-treatment technique to address the area that's on the outside of our thigh, outside of our leg, that oftentimes gets tight whenever we have knee pain, hip pain, or particularly when we exercise with lots of jogging, running, or biking. So we're going to start by getting a pillow between the knees, and then I'm going to have you put the ball underneath you so that you're on top, underneath your lower leg, just above your knee area. So what we're looking for is an area of tightness or soreness. So you can roll around a little bit or shift your weight slightly until you feel a bit of tenderness or tightness. And once you find that spot or area of tightness, then you want to wait there, remembering that it takes 4, 5, or 6 minutes of gentle, prolonged pressure in order for our fascial tissue, or the tightness in our body, to soften and release. And we want to use our breath to help facilitate the release. So we're going to breathe right to where we feel that tightness or soreness, letting our body soften over the ball. And as we breathe out, letting our bodies soften into the table or soften into the bed. Anytime that we're dealing with the fascial system and looking for ease in our bodies and looking for ways to soften and open up, it really is a whole body process. So using our breath helps to facilitate that whole body process and engage every aspect of our being so that our tissues can let go. It's important to keep the intensity low, because anything that feels like it's too much or too intense, our body will instinctively tighten up against it, even though we're telling ourselves to relax, and even though we're telling ourselves that it's okay. So we want to avoid anything that causes us to brace. So anytime that we're self-treating, if we find an area that is tender or tight and it's a bit intense, if it's too intense, it's okay to work around that area for a while so that we're not bracing and we're not holding and that we're getting effective releases. And as your body releases and the tension starts to leave our tissues, you will actually be able to feel it. Because the soreness will start to dissipate, the pain will start to ease, and the tightness will start to disappear. So as you feel the sensations go away, then you know that the tissue is soft and open. You've had some really good releases in your fascial system, and it's okay to move on and treat another area or use another self-treatment technique. So when this area has softened and opened, then it's okay to go ahead and move the ball up about an inch towards our hip. So go ahead and just move the ball up towards your hip a bit and come back over. And just taking a moment to see what you feel. And if you don't feel anything, just move around until you find a spot that does feel tender or tight. One of the other ways with this self-treatment technique that we can modify the intensity of what we're feeling is through the position of our legs. So in general, the more we bend our knees, the less intense it is, and the more we straighten our knees. So if you just want to try that, go ahead and straighten your knees a little bit, just gentle, a little bit. Can you see how that changes the pressure or the intensity?
Yes.
So if it feels like it's too much, then just bend your knees a bit. If it feels like you need a bit more pressure, then you can straighten your legs a little bit. And regardless of where we have symptoms, It's important to treat both sides of the body just to keep both sides balanced and functioning well.